this really is a holistic approach to the patient aimed at quality of care. And it's really patient-centered.
It is a combination of things that we do to help patients have the best possible outcome throughout their surgical experience.
Over my lifetime, I've probably had 7 surgeries, and none of those surgeries prepared me for what I heard when I was going to have Whipple surgery.
So Mr. Braun is a perfect example of a patient who was very scared and concerned about his upcoming surgery, and he benefited greatly from the collaboration of excellent surgeons and anesthesiologists throughout his process.
And I think it was Dr. Kolarczyk that talked with me, saying that this new enhanced recovery program would be part of my care. She then went through and described the differences and what they were doing and what they felt the impact of these differences would be on my recovery. And everything that she described to me is exactly the way my recovery went.
What it is a series of evidence-based practices to help improve patient care that begins in the pre-op setting, carries through all the way during the surgery, and of course, till the time they are discharged from the hospital. Every single detail of the perioperative process is thought about carefully and is based on the best available evidence that we have.
It was Dr. Ramage that recommended Dr. Kim. I don't know what it was about him, but right off the bat, we felt very much at ease. And he sat down beside me and he began drawing a picture of my stomach and talking to me exactly about what was happening inside my pancreas and what he felt the steps would be to solve the problem. We listened to him, and by the time he was done, I had total faith in what he was planning and what he wanted to do with me.
It allows this coordination and communication between all of the people that are involved in the patient's care from the very beginning to the time they leave the hospital. I think that's something that the patients will really notice and the patient will really benefit from.
I think one of the main things that helps these patients out is definitely their pain control, but also it's a very prescribed protocol where there are tubes, such as their NG tubes, a tube that goes into their nose, or a Foley catheter. These tubes that go into their bladder are removed earlier, which also encourages early ambulation as patients aren't tethered to the bed. We've even taken to looking at exactly how many laps equal a mile. 15 laps equals a mile. One lap is approximately 350 or so odd feet, and we even put little UNC feet around the wall just so we can encourage patients to keep up with how far they're walking. With the goal being in mind that everybody's up on post-op day number 1, and we increase how far they walk every single day.
When I walked on the floor, you know, the nurses knew me because I passed their station so many times. And they always had, you know, a fun comment for me. The whole experience was just very, very pleasurable.
It's about breaking down the barriers that sometimes exist in hospitals between nurses and surgeons and anesthesiologists. It's about coming together for the common goal of taking a patient from the preoperative experience through the intraoperative experience and through discharge with the best outcome we could possibly achieve.
I think I went back to my normal activities probably in about a month to a month and a half. Some of the more strenuous activities, like pickleball, took probably 2 to 3 months before I was back, and Dr. Kim would allow me to do that, which was a good decision. If I were to do it in 2 words, I would say that my care at UNC was wonderfully outstanding.